Today, we're going to talk about drug addiction, people struggling with chemical dependency. In my next video, I'll talk specifically about alcoholism, but today we focus on drug addicts. Why addiction is so complex. Addicts usually have mixed dependencies. They rarely use just one substance. Most often, they use several drugs at once. The lower they fall, the broader their circle of cravings becomes. Along with chemical dependency, they often struggle with alcohol, gambling, computer games, compulsive overeating, sugar addiction, anything that gives an instant impulse of pleasure. The addict's psyche. Many addicts have had difficulty controlling impulses since childhood. They cannot stop themselves, whether it's candy, spending money, or risky behavior. Almost always, there are comorbid psychological disorders, antisocial personality, bipolar disorder, schizotypal personality, borderline, psychopathy. Chemical dependency often goes hand in hand with these issues. Classic addict profile. Over years of practice, I've observed hundreds of patients, and here's the classic profile. 1. Complete lack of control. The person cannot stop themselves and cannot learn from mistakes. At 40, they behave like a 14 to 16-year-old. They are eternal teenagers, impulsive, immature, living only in the here and now. 2. Zero responsibility. Like a child, only pleasure, only the moment. Even if clean for a year or two, their thoughts revolve around pleasure. How to get emotions, adrenaline, sex, gaming, a fix. 3. Lack of self-criticism. They may sense something's wrong. 4. Extreme emotional sensitivity. They are easily hurt, unstable, and cannot handle pressure or criticism. They gravitate only to people like themselves. It's simpler. 5. Fear and avoidance. Most addicts are incredibly fearful. They lack a fighting spirit, broken early in childhood. Fear consumes them, which drives them to drugs. My experience with anonymous addicts groups. I've run many groups, sometimes 20 to 30 people in small basements. They were sober, but physically worn out, missing teeth, criminal records, hepatitis, HIV. The atmosphere was often like a shadow of death. Someone might attend today, gone by next week. And yet, they were some of the most fascinating, deep, and why they are so captivating. Paradoxically, an addict can be deeply warm, close, and genuine. They feel deeply, love sincerely, and can truly connect, but only safely with people like them. And here's the danger. One moment, they are your closest person, the next, they can be a liar, thief, or betrayer. That line is razor thin. Why people become addicts? The reasons are always complex. 1. Biological predisposition. Addiction often runs in the family, father, grandfather, other relatives. Impulsivity, sensitivity, and anxiety are inherited traits. 2. Dysfunctional family. 2. Create an addict. Usually two things are enough. Take away independence. I'll do it for you, you can't handle it yourself. Constant humiliation. You're worthless, you're weak, you'll never succeed. Treatment. The key rule. There are no former addicts. Addiction is lifelong. The most effective method is the 12-step program. It includes the idea of a higher power, God. This is crucial. The addict must replace one dependency with a safe one. Often, it's religion. And yes, it works. The most important element, a sponsor. A sponsor has completed the 12 steps and has a period of sobriety. The addict can call them at any time to share cravings, fears, or relapses. Without a sponsor, recovery is extremely difficult. Family work. Treating only the patient usually fails. In 90% of cases, the mother is codependent, controlling, or enabling the addiction. Sometimes, you have to treat the mother, not the son. Strict routine and no free time. The day is scheduled minute by minute, groups, meetings, work, study, therapy. Freedom equals risk of relapse. Conclusion. Addiction is terrifying, but understandable. These people are both the most difficult and the most fascinating patients. They are vulnerable, sincere, live in the moment, and can love, but need strict guidance and life.